It's a great pleasure and an honor to be a speaker and also a gold sponsor at this year's HIMSS 2021 India chapter. We believe that voice is going to play an absolutely critical role in making sure that adoption happens actually. The reason being that firstly, the speed is, a clear differentiator. I mean, it's 4 to 5 times faster by speaking into a computer and getting an accurate transcript out, along with things like very advanced command and control, right? All of this can be done through voice. And I think another very interesting and important point here is that the intuitiveness of voice is absolutely critical, right? As humans, we're absolutely working as a voice communication between all of us. And I think we're becoming really good at doing that with computers now. Another thing is accessibility. Being on the cloud, it's very easy to sort of plug into all the clinical systems. And at the end of the day, it's really the rich information that comes out, the quality of documentation. Today, what I really want to show you is something that is right out of our voice user interface lab at Augnito. And this is a technology which is called NLU, or natural language understanding, which is like the next level after NLP, natural language processing. And really want to show how this technology works and why we believe it's such a big revolution coming up.
Start note. Fever and headache since last 3 days. Family history of diabetes mellitus. Allergic rhinitis. COVID-19 pneumonia. RT-PCR. Monitor SpO2 daily. Tablet azithromycin. 500 milligrams twice a day for 5 days. Add code.
Now, wasn't that slick? So I just want to take this back here and really show you why a voice user interface is very different, right? Now, your typical graphical user interface based clinical systems, you would generally see a bunch of fields. You'd see a lot of buttons. You'd see a lot of drop downs. But as you can see with a voice user interface, you can actually have a completely clean interface, right? That's driven completely by voice. But the really powerful technology here is look at how the structuring has happened just from completely unstructured dictation. It broke, fever and headache since last 3 days into chief complaints, it picked up what the history was, etc. And the other part is just with a simple voice command, you could get your SNOMED CT and ICD-10 codes right up there. So this is more really to demonstrate that, these are the types of interfaces of the future in healthcare. This is something we believe very, very strongly. We believe that really OPD is the area that can benefit greatly from the VUI. Reason being that it's a completely hands-free experience. You have time to sort of look at the patient, talk to the patient. Just the speed makes all the difference. You could see that this was done within less than 30 seconds. And, when designing this, and at Augnito, we've spent a huge amount of time really focusing on human-centered design. And really the doctor, when they were doing the SOAP note, has really been the center of our universe. And we've really designed for them, right? Another great aspect is that it can directly integrate with existing EMR systems, through a HL7 FHIR interface if required. And I think another very interesting data point is that we've looked at several large healthcare organizations, and we believe that if you can actually integrate voice across these systems and the continuum of care, you can actually add close to 50 crores to your net profit. So we just thought that that's a very powerful piece of data to share. This is something that's really close to my heart, the whole topic of voice biomarkers. And it's another area that we've been researching on at our VUI labs at Augnito. A voice biomarker really is something that we can think of as, for example, that you're on a work trip and you give your mother a call. And within seconds, your mother would be able to tell, hey, son, you're tired, or you're sounding depressed, or you're sounding low, right? Now that sort of sense that your mother got very quickly, would be actually through a voice biomarker. And I think that AI is becoming extremely good at picking this up. So I'm going to actually deep dive into one use case, which is very, very interesting. And that's the use case of mental health. So this is a quote by Dr. Gomi, who's at the Memory and Brain Wellness Center. And it's pretty clear from this quote that, we have a lot of muscles that are involved when we talk, sections of the brain and stuff like that when we're thinking of language. So all these have actual features, that are picked up in deep learning systems. So this is an example, really looking at the correlation between a psychiatric disorder and speech, right? And as you can see, I don't know, it's quite small here, but this line here is for depression. And as you can see, there's so many unique features right up here. You could have a slight jitter in the voice. You could have, the speech rate. These are all unique features, right? And I think that's what makes it very, very powerful. And again, when you look at schizophrenia, again, a lot of unique features, again, anxiety. So I think what's important to sort of imagine here is that you can have a extremely cheap and scalable technology that, based on on an app that can scale up to hundreds of millions or even potentially billions of people as a diagnostic tool. And you can imagine, the type of cost and saving that this can bring, right? So I think this is a very interesting case, and really, really enjoying working on these type of technologies. I'm going to be launching really our white paper, really with some actual facts from 100 enterprise customers, which will really show you some of the benefits of using a technology like Augnito. One thing that's coming out very, very clearly is that there's a huge productivity gain. Really the majority of our respondents said that they're gaining close to 2 hours every single day by using our technology. And as you can see on the right, there's a 4x to 5x gain compared to something like typing. So very powerful facts, and another part here is the cost of documentation per month. So we've actually spent a lot of time analyzing this, and we've broken it up into all the sort of clinicians that would be there, from an employee doctor to consultant doctors, and even to nurses. You can see there's a drastic improvement in cost. I think, when we look at an area like nursing, they spend close to 35% of their time actually on documentation. So imagine freeing up a few hours for them in a hospital as well, right? I wanted to say that, it's been a 18-month journey since we launched Augnito. Augnito really comes out of ScribeTech, which is really the leading healthcare BPO in the NHS in the UK. We've actually been at it for 2 decades, but we launched Augnito really as a disruptive technology within our own organization. And in 18 months, we have 100 enterprise customers, 6,000 healthcare professionals using it across 7+ countries. And I think the main point is that this actually works across all medical specialties and subspecialties. So that's really the power of Augnito. And I think this is something that is really gaining a lot of traction in the market. And we weren't really able to put all our esteemed customers up, but here's a few of them, who trust Augnito and who were helping with their overall documentation processes. And Yeah, I just want to actually launch this white paper today. So, I'd encourage everyone to please go ahead and download this. Thank you very much. Real pleasure. Thank you.